blood pressure measurement is a critical clinical skill that is often overlooked in medical training. As part of its mission to improve cardiovascular disease outcomes, the AMA has built the Student BP Measurement Series, a free training resource that helps faculty teach and assess this skill at various points in medical training. This series consists of 5 interactive modules that help students build, maintain, and refresh their BP measurement skills. Here are some strategies and tips from faculty for implementing the series.
We observed so many errors in blood pressure measurement before implementing these modules, from using the correct size cuff, ensuring the patient was prepared correctly, ensuring that they were positioned correctly with their feet on the floor and their back supported. So there were just so many opportunities for improvement.
We focused on using the AMA Blood Pressure Essentials module, and not only did it provide content on how to position a patient, how to place a cuff, but also even more comprehensive content on what kind of external factors might influence taking an accurate blood pressure measurement. It was very helpful to have students review these modules prior to our hands-on practice sessions. And not only was it to give them structure to follow, but have that foundation of knowledge built upon before they came into these sessions to practice with each other.
In the Rural Health Clinic, the students had the opportunity to educate the patients on best practices for self-measured blood pressures, as well as educating them on how to use their blood pressure device that was often given to them at the same session so that they could measure their blood pressures and bring those readings back to the clinic.
We used pharmacy students in our interprofessional activities where we taught students the importance of self-measured blood pressure and how to teach somebody how to take their blood pressure accurately and be a little bit more aware of the errors that can be made by both healthcare professionals as well as patients.
They also have the opportunity to take the lessons they learned during the self-measured blood pressure module as they educate the patients on how to perform their measurements at home.
Accurate BP measurements are critical in diagnosing and managing cardiovascular disease. By making sure every healthcare team member is confident and competent in this skill, we are one step closer to improving cardiovascular disease outcomes.
We incorporated the AMA blood pressure modules with 5 of our interprofessional schools of health science students, including medical students, nursing students, physician assistant, dietitian, nutrition, and pharmacy students. We created these signature events that allowed the students to implement their skills that they learned from these modules together in an interprofessional setting, and it really helped to have our medical students interacting more with our nursing students, with our physician assistant students, with our nutrition dietitian students, and with our pharmacy students, and create those connections that they wouldn't have otherwise made in their standard curriculum.
The students seemed to understand how it was important for everybody to know how to do this correctly, because everybody is going to take a blood pressure or teach a patient how to take a blood pressure, whether it's a pharmacist at a pharmacy or a healthcare professional that's working in the clinic or the hospital.
This initiative by the AMA to standardize our blood pressure instruction across different health profession sciences helped to break down silos between our training programs and improve our blood pressure measurement skills and knowledge together.
Join us in standardizing and improving blood pressure measurement training by implementing this series into your curriculum today.